Hey there, welcome to another episode of the Health Tech News brought to you by Medics in Tech, your go-to platform for everything happening in the world of health tech, whether it's news updates, job opportunities, career development. For today's news updates, I'm going to be doing a quick May roundup, just in case you have updates you have missed. So let's get into it. Welcome back. First on the news is an update from the Lagos State Government. The Lagos State Government has taken significant steps towards modernizing healthcare delivery by digitizing 100 primary healthcare centers, PHC facilities, through the deployment of electronic medical records, EMR. This development marks a major milestone in the Lagos State Government's ambitious plan to roll out electronic medical records across all the 326 primary healthcare centers in the state. So, to affirm its commitment to transforming healthcare through technology, the Lagos State Government organized a 2-day progress review workshop on the Lagos Primary Healthcare Digitization Project on the 23rd of May. This workshop was organized by the Lagos State Primary Healthcare Board in collaboration with the Clinton Health Access Initiative with support from Gates Foundation. This workshop brought together stakeholders to evaluate the distribution of electronic medical records to these digitally enabled primary healthcare facilities. Present at this event was the Special Advisor to the Governor on Health, Dr. Mrs. Kemi Oguyemi. She emphasized that the digitization of PHCs is not just about innovation, but about building a smarter, more sustainable health system that delivers better care to Lagosians. Also present at the event was Dr. Oluwatoyin Adeyemi, who represented the Senior Special Assistant to the Governor on Health. She said, EHRs improve diagnosis, track patient outcomes, support referrals, and strengthen our capacity for real-time surveillance, but they must be sustained by robust systems and long-term financing strategies. Lastly, speaking at the event was the chairman of the Local Government Development Area, Honorable David Odubanko. He said, the manual system is outdated and inefficient. With the EMR, patient information becomes readily available at the touch of a button, facilitating faster and more accurate care. He disclosed that the pilot phase at Omba PHC has already commenced, supported by trained IT staff, upgraded hardware, patients' medical cards, and fiber optic internet connectivity. This is a huge one for the Lagos State Government, especially the fact that this innovation is going directly to the primary healthcare centers. And I'm super excited about this. Way to go, Lagos State. Okay, so let's move on to the next update. Next on the news, an update about African startup. African health tech startups raised only $200,000 in Q1 of 2025, despite global funding spike. This is really a state of emergency. And don't worry, I will tell you why. African startups attracted only $200,000 in the period under review. Now, let's do some comparison. Healthcare startups in Latin America raised $49 million within the same period. And that's not all. Health tech startups in Oceania raised $200 million, and health tech startups in Asia raised $300 million. Now, what I just said is just a tip of the iceberg. The largest funding was recorded in developed markets of Europe and North America, where startups raised $1.5 billion and $3.4 billion respectively. Now, looking at this huge gap, how do African startups meet up with this? Even though this is not a competition in itself, but we really need to do better in terms of accessing funding. Well, from everything I've shared, we can conclude that health tech funding is largely a feature of developed countries. This can be a function of the fact that these developed countries have standard digital infrastructure and they have a well-to-do population that can access or pay for these services. But what do you think? What do you think African startups need to do better? Or do you also agree with the fact that it's due to the lack of resources or platforms that can enhance these solutions? Let me know what you think in the comments. Now, to the next exciting update. Millions of patients can now track their prescriptions in the NHS App. One exciting thing for me about NHS every time is how intentional they are about digitalizing their health facilities across the UK. So let's get to know more about this update. Millions of patients can now track their prescriptions thanks to the rollout of a new feature in the NHS App, helping to reduce unnecessary calls and visits to pharmacies. Yes. These are the kind of updates I like to hear. Any innovation that will reduce the number of visits to the hospitals, to the pharmacies, to the laboratories is something that is highly welcome, considering the fact that the population in the world is increasing every day. So having this kind of innovations is truly amazing. Now, let's get to know more about this update. NHS England recently announced that nearly 1,500 high street chemists, including every booth in England, are now offering the service, which enables patients to check on their prescriptions through real-time Amazon-style updates. Now, this technology that allows patients to see their prescriptions on the app will not only improve the experience of patients across the NHS, it will also provide pharmacists more time to advise patients and to also devote time into research. Again, this is exciting and truly amazing. Now to the last update for today. I believe you've had a great time updating yourself about the recent happenings in the world of health tech. So if you're yet to subscribe to this channel, do that now and turn on your notification to ensure you don't miss out on any of our updates. I hope you've done that. So let's go to the next update. This last update is truly interesting, exciting, and amazing, and you get to know very soon. Let's get into it. Earlier this month, scientists used CRISPR technology to achieve a major milestone, and that is to edit the DNA of a baby with rare genetic disease. The patient, who is now a 10-month-old baby, KJ, is the first person in the world to receive a personalized gene editing therapy. Okay, I don't know if you're getting the interesting part of it yet, but I have more in store for you. Let's go. Not long after he was born, KJ was diagnosed with a rare, life-threatening genetic disorder called CPS1 deficiency, which affects just 1 in 1.3 million babies. The disorder is caused by a mutation in a gene that affects a baby's ability to properly metabolize protein and results in toxic levels of ammonia building up in the body. Now, unlike other CRISPR therapy, which was designed to be used in multiple people with the same disorder, KJ's therapy was designed to correct his specific disease-causing mutation. One of the researchers involved in this study, who is a hematologist and a gene therapy researcher, John Rasco, said, "This research is a significant advancement in their abilities to modify human genes." Also, according to the lead researcher, Rebecca Ahrens-Nicklas, from the Children's Hospital of Philadelphia, she said, "While KJ is just one patient, we hope he's the first of many to benefit from a methodology that can be scaled to fit an individual's patient's need." So now, I hope you got the interesting thing about this technology and, an advancement in gene therapy. I hope this particular update interested you as much as it did to me, maybe because I'm interested in things that has to do with molecular genomics and all of that. But the exciting thing is, with this innovation, with this technology, more rare genetic diseases can be taken care of with customized gene therapy. So I love technologies that are, solving problems that we are not even problems that healthcare providers have not been able to find access to in the past. So of course, this is interesting and exciting. And that's it for the news today. Thank you for joining me in today's update. I hope you were able to get new updates that you probably missed and you're able to learn new things. Let me know in the comments what you think about this update and one thing you've learned today. Do not forget to subscribe to this channel. I will see you next month. Bye.